My name is Alexandria Lamb, and I'm going to be giving a speech about proper analgesia in veterinary medicine. If you go to the doctor for surgery and do they prescribe you a pain medication? If you have the ability to, would you decline this pain medication? I'm a registered veterinary technician and have been working in small animal surgery for the past 4 years. Owners can approve and decline their pet's pain management. A number of owners will decline this pain med because they feel like their pet does fine without it after surgery. Common medical procedures like ovariohysterectomies and castrations, or otherwise known as spays and neuters, can be painful, and it is the owner's responsibility to make sure their pet is as comfortable as possible in recovery. I'm going to explain what these pain medications do and why they are needed postoperatively. Animals differ in the ability to show pain. They cannot tell us if it hurts or where, and it is the owner's job to make sure that they pick up on any changes that their pet has. Declining pain medications can be a way to pinch pennies or to save some money on their bill, but it can be harmful for the pet. If left untreated, pain can negatively affect the patient's behavior, physiology, metabolism, and immune system, causing poor performance, weight loss, and increased susceptibility to infection, as described by John Thomas and Phil Lurch in the Anesthesia and Analgesia for Veterinary Technicians in 2011. Pain will not look the same in every pet. In dogs, they may become clingy or lethargic or vocal. In cats, they can become aggressive, solitary, or depressed. Animals should not have to prove that they are in pain to receive analgesia, as stated by Marion Tier in Small Animal Surgical Nursing in 2012. Analgesia is described as the absence of pain. If a pet does not exhibit odd behaviors or changes, that does not necessarily mean that they are without pain. They simply may be stoic. Now that we have seen the problem that pain can cause in our animals, we can look to a solution. Understanding what the pet looks like when they are in pain can help us determine what they need. In these charts, we are able to see what dogs and cats look like. The ranges go from 0 to 4, 0 being the least pain and 4 being the most. We also can see different symptoms and signs that they will show during the painful episodes. Veterinary staff are able to use these pain scales for each individual patient. Approving pain medication postoperatively can relieve issues as seen and as described. NSAIDs are non-steroidal anti-inflammatory drugs that are commonly used postoperatively in humans and animals. They inhibit a specific enzyme to block the inflammatory response, which prevents pain. NSAIDs are very useful analgesic drugs and have been shown to work synergistically with opioids when used together, as explained by Joyce Wanamaker and Kathy Massey in Applied Pharmacology for Veterinary Technicians in 2015. Opioids are given prior to surgery with other injectables in preparation for surgery. This, along with anesthesia, allows for pets to have multimodal pain control. Multimodal pain control is using multiple receptors to block multiple types of pain. So these are the types of receptors we can see, from transduction all the way to perception. The NSAIDs and opioids are used in different parts of the multimodal process. This allows the pet to be comfortable throughout the entire procedure. Now that we see what can go wrong and have a plan, we can look toward fixing it. Management of pain requires a continuum of care that includes anticipation, early intervention, and evaluation of response on an individual patient basis. As described by Mark Epstein and colleagues in the AAHA AAFP Pain Management Guidelines for Dogs and Cats in the Journal of the American Animal Hospital Association in 2015. When the pet is discharged, it is our job to educate the owners about signs and potential dangers we can see with pain. And this improves the likelihood of the pet getting proper pain control and improving healing times. Doctors and staff can educate on signs of pain, and educated owners are advocates for their pet, informing us of responses they have at home. This will equal happier recoveries and pets feeling better quicker. In conclusion, postoperative pain management allows multimodal pain control after spays and neuters. Common medical procedures like ovariohysterectomies and castrations are painful, and the owner is responsible for keeping the pets as comfortable as possible during recovery. We always want you to approve pain medications postoperatively for faster healing times, improved comfort, and better experiences with medical procedures. As described by Joanna Bassert in McKernan's clinical textbook for veterinary technicians in 2014, pain is considered to play such an important role in overall health and well-being that pain is now regarded as a fifth vital sign, ranking it equal importance with temperature, pulse, respiration, and blood pressure. Thank you, guys.
Woo! Well, I'm talking about, that's how you control pain. Oh my God.